Welcome to Compassionate Care. And today I'm your host, Kamis, and I have with me Sasha. Welcome, Sasha.
Thank you.
Yes, so Sasha, who are you and what do you do?
Okay, I am currently a mom, a wife. I I am a licensed funeral director. I am also a patient care assistant at a prominent hospital in the USA. Um, I also have an engineering background,
Wow.
but right now I'm mostly momming and being a housewife right now.
Wow. So you're quite diverse, Sasha.
Yes.
Based off of what we're hearing here, you're quite diverse. So, Sasha, the reason why I have you here a year ago, a situation happened with you a year ago
Yes.
while traveling back home. Was it 10 minutes before you got to your
28 minutes.
28 minutes before you got home? What happened? There was a traumatic experience that took place with you. What happened, Sasha? Can you give
Okay.
us a breakdown as to what happened?
Sure. So I was coming from a prayer retreat, which the drive should have been 7 hours away. However, along the way, I got tired. I pulled over to sleep. That 7 hours was now going to become 9 hours because I stopped. And as a result, it extended when I was supposed to reach home. Anyhow, when it's 1 hour before, I became tired again. So I was searching for another rest stop to no avail. One of the places that I end up reaching was they call it a way station, but some way stations in my state, they also have somewhere where you can park, or the truck drivers rather could park and sleep. I went to that way station, there was none. It was pretty much like a pole. You go to the left or to the right, you weigh your vehicle and you come out.
Hmm.
So I'm looking for somewhere, and I was like, okay, we're only an hour away. I guess I just have to push it. There's no, there's a guardrail on one side. Um, I'm going down through a mountain to go down in the valley because I lived in a valley,
Hmm.
and there's nowhere to pull over. Decided to wind down the window and say, okay, God, it's me and you. By the way, at the top of the hour, I also called my husband. I was talking to him, and he's like, okay, so you'll be here soon. Um, so he was looking out.
Hmm.
Next thing I knew, I heard booga 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 booga. And I just felt the car, and it started spinning.
Hmm.
And in that moment, I felt like, I don't know if you have ever watched a movie, but I felt like I was in an astronaut movie and just watched things just spinning around me. Even though I was going in slow motion, I was very still, but everything was spinning as the car was flipping.
Mercy.
Come to find out, at the end of all of that, my car door was jammed. It was ajar. Couldn't open the door.
Hmm.
So first thing I stopped, I prayed. While I was flipping, I was also praying.
Hmm.
Um, I stopped. I prayed. The first prayer was, okay, Father, I need to find my flashlight. I dipped and I found the flashlight right away. Okay, next I need to find my phone. Found my phone right away. Before I found anything else, I sent out a SOS to the ministry I was coming from to say, car flipped, waiting for rescue, not sure. I know I'm in the mountains, not too far away. I thought I was about 30 minutes, but actually it was 28 minutes. Try
Wow.
to call my spouse, could not get him.
Hmm.
Couldn't get anyone else. But I like, they're praying. Who we will find a way to reach who we need to reach.
Hmm.
Then the next thing I was like, okay, I need my shoes. I The Lord showed me where my shoes was. I used to teach disaster response for my conference.
Okay.
So I knew a little
What
bit
to
more
do?
about what to
What
do.
to do
I
during
had my book
disaster?
bag. I felt where it was. It was
Hmm.
still there. It was packed, ready. It had my ID. I took out the information
So what
from.
is that though? What does that entail? You said you have a disaster bag. Is there a certain things that's in the disaster bag? Can
Yes.
you just list what are the things that would be in a disaster bag for those who have never
Okay.
packed one or knows what that is?
So for a disaster
Mhm.
bag, which for me who's traveling, I put my my identification, or at least a copy of my passport,
Okay.
who I am.
Mm-hmm.
I put, I would have like granola bars, I have water, I have
Mm.
a change of clothes, I would have something very thin, maybe like a fleece, little
Mm-hmm.
blanket, something that could
Could
keep me
cover you.
warm.
Okay.
I might have a raincoat in
Mm-hmm.
there in case it's wet.
Mm.
Um, what else would be in there? You know, toiletries, toothbrush, toothpaste. If I get stuck somewhere,
Mm.
I can go. It also has like a flashlight,
Wow.
just emergency items. It also
Mm-hmm.
has a paper with a contact for emergency in case something happens to me and I'm not able to speak. Somebody
Mm.
can go through the bag. They can call somebody
Right.
that to contact to let them know that I'm injured.
Mm.
Um, and so I didn't know if I would be able to get out of the car, because another thing is that the car was also smoking. I
Wow.
couldn't get out. All the airbags have descended. It looks like a curtain in my car.
Oh
And so I
my.
grabbed the bag,
Mm-hmm.
also grabbed the information from the car in case the
Mm-hmm.
car blew up.
Yeah.
Um, so they would know who was in the car. I
Mm.
threw it as far as I could through the window, as far away. I also I grabbed, my daughter had a
Mm-hmm.
booster seat,
Mm-hmm.
because I was in the mountains. I had an idea. I
Wow.
don't know exactly where I was, but I
Yes.
was in the mountains and I was at the bottom of a precipice, which I'll go to
Ooh.
tell you how far
Mercy.
down I felt. I threw that out. I
Yeah.
also threw another bag with that I had clothes and stuff from
Mm-hmm.
as far as I
So
could.
they could see if
So
anything, or you can
if
grab it to
anything,
go. Okay.
I need to set up shop
Wow.
out there until rescue came. And then
Wow.
each time I was throwing, I would flash the flashlight up and
Mm.
back and forth like a SOS in case somebody's passing up on the
Smart.
top of the road, so they
Wow.
could get a signal.
Mm.
Um,
So
just
you were just, you had all the knowledge. You're just ready to
yes, you
go.
never know
You
when
had
you'll
to be
use
prepared.
something,
Wow. That's
right?
amazing. Yeah. Go
Yes.
ahead.
So just when I
Hmm.
was about to pull out myself through the window, because I'm like, I'm not staying in this car.
Yes.
It's smoking.
Wow.
The
Were you
back is
scared?
smashed in. I was not scared.
Wow.
The Lord gave me a
Brave.
peace that passed
Oh,
all
understanding. You
understanding.
sure had it.
As I said,
Wow.
while I was going
Mm.
and it was spinning, it was like I was a spectator in the whole
Watching
thing.
a drama,
Mhm.
not realizing you're in that
And the
drama. You're
drama
part
is
of it. It's
slowed down. It's going in slow
wow.
motion.
So your car flipped. You said how many times did
My
that flip?
car flipped
Hmm.
about 9 times. It
Wow.
flipped 127 feet from
Whew.
the top of the precipice, from the top of the road to the bottom of the precipice.
Wow.
Um,
So it's just God. So here you're alert, you're doing all these things, you're giving signals for anyone to see. You're throwing things out so people can know, and you can also help, use these things later if needs be. So you're fully alert, you're
I'm fully
awake, you're
alert.
alert, you're orientated, you're not disorientated in any way. Were you dizzy at this time, or
No,
no dizziness? Just
nothing.
you're just in
Already
survivor
sent texts
mode.
out for prayers.
Text, wow.
I called
Calls
my
you
mom.
made,
I tried to reach my mom. I tried to reach my stepdad. I tried to reach my
wow.
husband. Could
Mm-hmm.
not get them. And I'm
Mm-hmm.
like, the prayers will go out. Somebody will hear. Somebody will see. And
Right.
then I was
Just as you're about to,
go through the
go through the
window,
window, uh-huh.
right,
Mm-hmm.
to pull myself out.
Mm-hmm.
I saw sirens coming down with a
Wow.
truck, and it's like I could supernaturally hear them, because they were like at least 100 to 200 feet from me. They were far.
Mm.
And I heard like them saying, "You think we have to get the jaws of life to get her
Mercy.
out?" And I'm
That's
like,
serious.
"I'm fine. You don't have to get the jaws of life. I'm just getting out. I can move."
So rolling 9 times, and you're
Mhm.
telling them all this. Wow, amazing.
And
That's
then
God.
they're
Yeah.
like, "Oh, somebody is alive." And then
Wow.
the person that it was two police officers, and
Mm.
one of them said, "Somebody has been praying for you, because we saw your windshield 50 feet up the road."
Wow.
I'm like, and they're like, "We see a car seat. Is there a baby in the car?" And I'm like, "No, I threw that out there along with my bag." So it's like, it was like a command center that I was commanded. And then
Yes.
the other guy said, "Let me try that other door
Mm-hmm.
on the passenger side."
Mm-hmm.
And the moment he did that, I started laughing. It opened.
Mm-hmm.
And I started laughing. The reason is,
Yeah.
about 2 months before,
Mm-hmm.
for about a good 6 weeks, my door was jammed.
Wow.
It
So
would
the
not
Lord
open. That
opened
door
that
was
door.
just fixed. I just bought and changed stuff, fixed that door.
Wow.
But for those 6 weeks, even to go to church everywhere, I was going over that the gear stick to get through the passenger side. And I'm like,
The
I
door
went
needed
over
to
it.
be open when it needed to be open at this particular time. That's God.
I went over it without an itch because the
Wow.
movement was already in my body.
Yes, yes,
And I'm
yes.
boom, boom, boom. It was
Survivor.
nothing.
Yeah.
It was nothing to go over it because in the time when my door wasn't working, my body already got the practice to go
Mercy.
over.
So
And
you
I
know
just
what to do,
started
how to get out.
laughing.
Oh my goodness. Wow, Sasha, what an experience, what an encounter. So you
Yes.
see God in it. I see a scar over your head. Is that from that
This is
injury?
from the
So
accident.
so
Yes.
from the accident, you sustained a head injury?
Oh, yes.
Okay,
All
so
right.
how
So
was, yeah, so
let's continue. So
yeah.
I get out the car, and then the other police said, "You have two people to thank." This is the other one. You have God and Acura, because there's no way that, like,
Mercy.
I have not seen the car as
Wow.
yet.
Yes.
So I go around. He's like, "Sit on the ground." I'm like, "I'm not sitting on the ground. What you gonna do?" Me telling the cop, "You gotta go over there and get a car seat, and I'm gonna sit on it. And while you're there, get my bag and get the other bag."
You're
I'm
commanding him.
commanding him. I'm the
Oh, wow.
I'm the incident
It is.
commander here. And I sat on that and I waited on that. And while I'm there, I'm like, I tried to get my parents, I couldn't get them, and my husband. And so the cop lent me his phone, and I was able to get through on the phone. I even get my mom, but my stepdad answers like, "Okay, don't worry about it. Just, go to the hospital. I'll get the word out to everybody." So by the time the ambulance came now, I recognized a guy because he came to transport persons from the hospital floor that I worked. He's like, "You're from the third floor at blank hospital."
Oh,
I'm
wow.
like,
So he
"Yeah."
recognized you. Oh, look at
I'm
that.
like, "Yeah. Can you take me to
Wow.
the nearest blank hospital?" The same one. He's like, "No, unfortunately, because, I work there, so I
Yeah.
have the insurance from there. So,
Yeah.
of course, things." He's
Yeah.
like, "No, I have to take you to the nearest trauma center." Like,
Yes.
nearest trauma centers. At this point, I even noticed I was bleeding. Nothing. Okay.
So you were bleeding.
I was bleeding.
So what, you're bleeding from your head?
I was bleeding from my head, and I got a little cut on
And
the
okay,
outer
on the-
part
yeah.
of my leg. And so I was telling him, "Yes, I have rollers for you in the medical, you people that draw blood,
Yes.
rollers, or if you ever go to get
So
your
you have
blood
all
drawn."
that in your car?
Huh?
You have all that in your car?
No, I was just telling him that
Oh,
I
you
have
show.
rollers.
You're
So,
showing. Oh, you're showing
yes,
where your veins
yes.
are. Okay. Okay.
If
got
you
it, okay.
ever, if you ever go to get your blood work done, just so you know, and it's like they keep sticking you and then you're not getting it, you probably have rollers. That's one of the things where they have to hold your vein down, or else it's gonna move.
Yeah. Okay. Yes. That's
So
what
I
you mean.
told
Okay.
him, you got to hold her down, or she's gonna
Oh,
move
okay.
on you. And I was just walking him through. Okay,
Wow.
here's this. Make sure you get my BP. He put on the EKG. I was helping to put on the leads
Because
on
you
myself.
have experience. That's
I
what you
have
do as well.
experience. What
That's
I
what you do as well too. So that's why. So
and
she's quite knowledgeable. Wow.
I was helping myself until he said, "Okay, we got to stabilize your back. We got to stabilize your neck."
Yes.
He put on the collar,
Yeah.
and then he said, "Lean back." After I leaned back, I started getting dizzy.
So
The
that's when
place
the
started
dizziness come in.
spinning.
Okay.
Next thing I knew, I woke up and I was in the trauma triage
Wow.
room, and they started saying, "Oh, we're gonna check for this, da da da," and I was like, "Okay, that means you got to do a CT, you got to do a chest X-ray, you got to do this. This is
you
me
know what, the
again,
whole thing again,
going
the
in
middle-
what I
yes,
need to do."
yes.
And when he said a CT, he said we did 7. I was like,
Wow. 7
okay.
CT scans?
7 CT. I'm like, okay, so I
Wow.
definitely blocked out.
Yes.
I have a concussion. And that's what I realized. In that moment, I did a little video,
Yeah.
just saying I could barely talk. I guess they had probably put
Yeah,
a
they
thing
probably
down,
they
to
put
try
a
to clear
trachea.
my
Yeah, not a
airways.
airway. Yeah.
So when you
yeah.
have a trach in your ear and take it
That trach.
out,
So you
you're-
did have a trach as well, because I see a cut there as
no,
well
this
too.
is this
That's
is from
okay.
younger.
That's from
They
younger.
put
Okay,
a,
that looks like a cut. Okay.
they
They tried to intubate you.
They intubate, yes.
you. Yeah.
Just to make sure my airway was
Right.
clear, because there's blood everywhere. So they want to make sure
Wow.
that there's none
Yeah.
blocking. And so my voice is all.
Wow.
And I felt pain. I was trying to send a message like, I love God. God is good. But I don't know. Maybe we'll be able to do a little drop in, or later you'll be able to see the
that
car
video.
that I walked
Oh
out of.
yes, we're gonna try and put that up. Yeah, for
Um,
sure.
but I succumbed to a concussion,
Mm-hmm.
after which I had to do 2 sets of therapy before I could do physical therapy. I had to do a neurotherapy,
Neurotherapy. Mm-hmm.
which is for my brain,
Right.
because each turn, when I turn my head like this, I'm dizzy. Do like that, I'm dizzy. Put my head up and dizzy. Every move I move, I turn my body, I'm dizzy.
Wow.
Dizzy, 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 dizzy. And that prolonged for about 4 months.
Oh wow. Okay.
Right? And I was able to go home 2 days after, because,
2 days.
again, I
Wow.
worked in the hospital. So I
So
knew
they.
the longer you
Yeah.
are,
Yes.
the harder it
It
is
is
to
to
get
get it
out.
out. Yes.
I
True.
pulled
So you
myself out by
pushed.
the grave. I felt everything, every pain. I
Wow.
felt the pain in my finger. I felt it in my phalanges,
Mm.
every muscle, every
Mercy.
bone. I felt
Oh my,
everything.
phalanges are hands,
Yes,
fingers.
yes,
For those that don't know
everything.
the term, yes. Oh
Everything in
wow.
my fingertips.
Oh
Every movement
my.
I felt every single muscle and tendon and everything
Mercy.
that had to do with that movement.
Wow.
Like, also, I fractured 2 of my vertebrae,
Ooh,
which
wow.
is my spine. Um, and I didn't know at the time, I had a what do you call it? I sprained my rotator cuff.
Ooh.
Yes.
So a lot of pain.
It was a lot of pain.
So were you on pain medication for that and
Yes,
anti-inflammatory and all that stuff?
I was on
A
pain
lot of stuff,
medication. I
yeah.
probably only took it for about 4 days.
That's it.
And then,
Wow,
yeah,
okay.
then I used ice and
Yes.
stuff, because,
Right.
I'm not trying to get addicted to no pain medication now. Yeah.
So you had to do therapy for a long time, for about 4
4
months, you
months
said?
for the neurotherapy, and then
Neurotherapy.
after that, I had to go do physical therapy.
So when you say neurotherapy, you said it's for your mind. What are the
For
things
my
that they
brain.
would? What are the things that they did? Was it
Some-
cognitive therapy that they do, like testing you to see if you remember certain things with little, like what was that? What was that look? How does that look like?
First,
for
when I
those-
went there, even when I wasn't dizzy, a part of my head felt like it was
Ballooning out?
constantly, like,
Throbbing?
pounding, throbbing. It hurt. It was very tender. I still got dizzy. They got you dizzy on purpose.
Wow.
Okay, so they'll give some exercise, like
Right.
or they put stuff in front of you. They did normal stuff that you would do in a normal movement, because normal movements were making me dizzy. So
Right.
they would force me in the clinical setting to get dizzy, and then that way, over time, they tried to see if it would take longer and longer periods for me to get dizzy, until I didn't get dizzy anymore, or until it was normal. They got me to a point where they said, okay, now once physical therapy clear you, you'll be able to drive, because I couldn't drive either. I'm
Right.
dizzy, so,
Absolutely not.
so they cleared me from a neuro standpoint.
Right.
And neuro means brain. And then I had to move on now to physical therapy, to strengthen back, my muscles and my arm, my shoulder, my back. I also had, like a back brace, and the first of it, I couldn't bathe myself. Like,
Wow.
my husband and my sister had to bathe me, because literally I hold my head down even to do the stuff,
You
and
felt
I'm
that.
dizzy. Even going
Yeah.
to the bathroom was a struggle, because to come off the bed, I even became a little incontinent. For anybody else who goes through, I don't know if you know. Should I say? Should I
That's
say?
okay.
So incontinent means
Yes.
you end up peeing yourself. Okay. And it's not because I just couldn't get there early enough.
Couldn't get to the bathroom on time.
Yeah, because I have to move,
Right.
wait to not get dizzy, then move again, wait to not get dizzy, move, and then even 2 times I almost fell off the toilet.
Wow.
It was rough, but
Yes.
I'm whole again.
You're whole again.
Yes.
And a miracle has taken place from trauma to
Yes.
triumph.
Yes.
God heals.
God is
and
good.
He's amazing. And you're coming from a prayer conference. So we
Yes.
see the power of prayer as well, that
Yes.
God still heals despite the roughness and having to go through this, this traumatic situation. There was still healing. The
Yes.
Lord came through for
The
you.
Lord came through.
Now, how was it with your family? And, do you have any children?
Oh, yes. I have very young children.
What are the ages at that time?
At that time, they were is it 4? Which month was it? So they were 4, 3, and 1.
Wow. So very young children.
Very young.
Wow.
When I came home,
Whew, that's a lot.
especially the 1-year-old,
Yeah.
he would come on Mama, and remember I said I'm feeling every pain.
Wow.
So he's coming even to give me a hug.
Hug, yes.
I am feeling pain. I'm dizzy,
Oh
and
my.
he loves to bounce. And we're like, gentle, gentle, gentle. You have to learn gentle. So at the time, my 4-year-old, my 4-year-old would try to teach him gentle, gentle, gentle. For that. And it's rough for kids. You're horsing around with the kids all the time. You bring them to the park every day or outside. And then all of a sudden you come back.
Can't do anything.
And then also my daughter, she came to the hospital to see me.
That's your 4-year-old?
Yes. Okay. And I was able to come out the next day. Yeah.
That must have been rough.
Yes. And she comes and she looked. And one of the other things God blessed me with a nurse that knew natural remedies.
Okay.
Because my church brethren, some of them, while it wasn't close to my house, it was right around the corner for some of my church brethren. And they came and visit right away. And I'm like, you have aloe vera at your house? Because they were just leaving the cut and it looks rose. I'm like, I need some aloe vera. And I said, go to your house, go cut me aloe vera and bring it back. And he brought it, and he brought castor oil right away. We doing that day one in the hospital still. And then the Lord gave me an African nurse. I'm like, praise the Lord for the African nurse. Because, sometimes at the hospital, they think if you use your home stuff that you're self-treating.
Yes.
And they
don't
not like
they
that.
Don't like that.
Okay,
yes,
she's like, oh, you use aloe vera on your foot because they're not putting anything on it because they want it. And then I would rub it. I clean it with the aloe vera. And I would use that every day between the aloe vera and the castor oil. And she was able to give me a little bandage and we cover it out. So I was sleeping now with the aloe vera under it. Me and her know, and the persons know, but the rest of the hospital, they not know. So if anything, they all say we self-treated. But that aloe vera, it got
the cut.
Got everything, that vitamin healed it very nicely.
It heals very nicely, yes.
Right?
Scar's not so
and the
bad.
castor oil was good because it would soak and it helps to heal the
deep down tissues, yes. Wow, amazing. So Sasha, I know you said you have 3 children. So were you getting help with the children, or are you just a single mom? Are you married? Do you have a spouse at this time?
I'm married.
You did mention you did your husband. You called your husband. I'm sorry.
I do have a husband, but my sister was helping. My mom was helping. My other siblings,
so you had a lot of help coming
was
in.
going around to make sure they got where they needed to go. And
'Cause
also I got where I needed to go because I also needed to go to the doctors and therapies.
And how often did you have to go to the doctors? Because having a head injury, that's quite,
I think I had a therapy
and stuff, so you had to
3 or 4 times a week.
A week, wow. So you're quite busy getting help. Okay, wow.
Also, for the paperwork to get the insurance and stuff done, a lot of persons from my church was instrumental in making sure they print out whatever, and we got stuff and got it faxed back to them.
So you're able to get, some compensation and stuff. Wow, so your story has been like a big highlight from last year till now, and to see the traumatic change and how God heals and brings and restores back is amazing. And you're back. You didn't lose any faculty. You're still going and able to order and tell people what needs to be done in order to get the proper care, and that's just amazing. God is such an amazing God. So so with that, was there effect in any part of your memory at all? I'm talking like within the first 4 months. Did you find any changes within the memory bank, or are you okay with that?
For sure. For sure. I was a little fuzzy. To begin with, I was forgetting things.
Yes.
But over time, I think it came back. The only thing I think may still linger is that one of my ears, sometimes the very high pitched note will bother my ear a little. And that didn't used to happen. But I think that might be the only thing that
like a ringing in the
lingered.
ears? You have the ringing in the ears at all, or no?
It's not a ringing. It's like if it's very high,
loud?
it's just
It affects you?
a little irritating to my one ear.
Wow. And that's the only thing the only effect. God is amazing. Because I know a lot of people struggle, and some people struggle for years. So are you back to work? Are you off work still?
No,
Like,
no, no.
has it?
I've been cleared and stuff for work. I'm back to work. I'm not working at a hospital now. I'm working with personal clients now because
Right.
that works out better for my scheduling
Right.
right now.
Especially at home and so on,
Yes,
right?
with babies.
Yes.
And I am also with child.
Wow, look at that. Amazing. That is amazing. So not only um, did the Lord bring healing, and now you are blessed with pregnancy, being
Yes.
pregnant and now expecting. That is awesome.
Yes.
Well, Sasha, I just want to thank you so much for sharing your story with us today. And for those who are on, online listening in and have gone through a traumatic experience, know that God is still able to heal. This is what this whole conversation is about. The power of prayer and the power of God still able
Yes.
to take us from our tragedy to triumph, where we can still, function and also be there to assist and help other people as well. What an awesome God we serve.
God is amazing.
So this is such a powerful testimony. I just thank God for just you coming on and sharing, and to help those all again, who are listening in. There's still power.
Amen.
Power in prayer.
God is able.
He is able. All right. So we want you to stay tuned for the next program. Thank you for listening in. And I hope this was a benefit for those who are listening into our program today, to be encouraged.
Yes.
That God is still there in your situation, whatever it is that you're going through. Know that you're not by yourself, and that He still is able to restore and bring you back to full function, if that is His will. So next time, I'll see you next time on our Compassionate Care program, and where we will be putting out another video. So please share, subscribe to those individuals would be benefiting, also listening for this broadcasting. So you take care. Have yourself a wonderful day.